The Santa Monica Sports Medicine Foundation proudly presents the PEP program, Prevent Injury, Enhance Performance. Bert Mandelbaum, MD, Diane Watanabe, ATC, Holly Silvers, MPT. This project has been made possible by funding from the LA84 Foundation.
Hello, welcome to the PEP program. I'm Dr. Bert Mandelbaum, team physician of the LA Galaxy as well as the United States soccer team. Our major goal is prevent injury at all times. As a consequence of this, about a decade ago, athletic trainers, doctors, and coaches got together to develop a program that is known as the PEP program. Designed simple exercises, 5 of them, that can be done on any field. Cones and a ball, simple, inexpensive, and it should be done 2 to 3 times a week. We have found in 2 studies that this program is significantly dramatic in terms of its impact at reducing injuries about the knee and specifically ACL injuries. It's a program that not only affects your ability to reduce the injuries, but it also affects your balance, your ability to have greater strength, and your stamina. And overall, and most importantly, you'll have a greater performance. The important thing is that you do it. There's no program that can reduce all injuries, but the real benefits of the PEP program, in addition to injury prevention, are that we can improve your balance, your coordination, your overall strength, and most importantly, we can help your performance. So go out there and do it. Best of luck and good health.
Knee injuries are among the most common and debilitating of all injuries. Many times they require surgery and extensive rehabilitation. But with some basic knowledge and a little hard work, you can prevent such injuries and look forward to staying injury-free for a lifetime. By participating in this program, you'll be able to increase the strength and stability of your knees. You might have seen some of these exercises before, but let's focus on how to do them correctly. Technique is crucial. If the technique is wrong, you aren't learning how to avoid injury. So pay close attention to the video. Watch the examples of how to perform each exercise correctly and watch the incorrect way of doing the exercise so that you can avoid the most common mistakes. Let's get started. Throughout the video, you'll hear us stress soft landing. Let's take a moment to explain what that entails. In order to protect your knee, when you land from a jump, you need to land on the ball of your foot with a bent knee and hip. This allows you to safely accept the weight of your body through your knee and utilize the right muscles for a safe landing. Let's take a look at how this is done. As our athlete comes down from his jump, notice his hip, knee, and ankle are in a straight line. His knee stays over the ankle joint, not translating over the toe. He lands on the ball of his foot with bent knee and hips. The back is neutral, not arched. This is correct form. Now let's look at some common errors. Watch athlete number 2 as she comes down. She lands with a flat foot, her knees cave inward, and they translate too far over her toes. These are the things we are trying to avoid. With this in mind, let's start with the warm-up. Let's begin our warm-up. The warm-up is a crucial part of the training program. It provides a smooth transition between the resting state of your muscles and full activity. This prepares your muscles and your cardiovascular system for activity. The first exercise is simply jogging cone to cone. It is important to stress good running technique. You want to keep the hip, ankle, and knee in a straight line. Make sure your knees do not cave in and feet do not whip to the side. This is an example of proper technique. Notice the athletes are in proper alignment. Remember, for good running technique, you want to avoid your knees caving inward. Also, you don't want your legs flailing out to the side. Perform this exercise for 30 seconds. The next exercise is a shuttle run. Begin in an athletic stance with knees and hips bent. Your toes should be facing forward and visible to you. Facing forward, you'll push off the right leg and move to your left. Keep your knees and hips facing forward without translating forward over the toes. Work across the width of the field and return to the starting point, pushing off the left foot. Notice our male athlete. He properly bends his knees and hips in order to engage his hamstrings and buttock muscles. His toes are facing forward and are visible to him. Our female athlete outwardly rotates her trunk, knee, and toe. Her knee and hip angle is too shallow. She needs to get deeper in her squat in order to engage her hamstrings and make the exercise effective. Her back is arched as well, allowing the pelvis to drop forward excessively. The last warm-up exercise is backward running. Run backwards from cone to cone. You want to make sure the athlete sufficiently bends their hips and knees, lands on the ball of their feet, and avoids locking the knee. Here's an example of good form. Note the athletes keep a slight bend to the knee and hip while remaining on their toes at all times. This portion of the program focuses on increasing strength. This will allow the athletes to increase their core and lower extremity strength, thus a more stable knee joint. It's all about proper execution. The first exercise we will demonstrate is walking lunges. This is a great way to strengthen the lower extremity. Lunge forward, leading with your right leg. Push off with your right leg and lunge forward with your left leg. Drop the back knee straight down toward the ground. Make sure that you keep your front knee over your ankle. Keep the hip, knee, and ankle in alignment and do not let the knee drop inward. Keep the shoulders over the hips. Control the motion by using your abdominal muscles and try to avoid your front knee from caving inward. Notice the good technique of the athletes. They're keeping their knees in midline directly over their ankles. The second athlete is showing poor control. Her knee is caving inward and it's extending out over her ankle. A good rule of thumb to remember is, if you can't see your toes on your leading leg, you're translating too far forward, thus doing the exercise incorrectly. The next exercise is the toe raise in 3 variations. Double toe raise, shown here, double toe raise with ball, and single toe raise. These exercises work the calf muscles in your lower leg while increasing balance and awareness of the hip, ankle, knee complex. To begin, stand with your arms at your side. Notice the athletes perform the exercise slowly and steadily without wavering. It is really important to focus on slow and controlled motion to get the most out of this exercise. As you get stronger, you may need to add additional repetitions to this exercise to continue the strengthening effect of the exercise. To begin, stand with your arms at your side. Notice the athletes perform the exercise slowly and steadily, without wavering. It is really important to focus on slow and controlled motion to get the most out of this exercise. As you get stronger, you may need to add additional repetitions to this exercise to continue the strengthening effect of the exercise. If you're having difficulty doing the double leg toe raises with proper form, you can use a ball between your ankles to assist you. By holding the ball between your ankles, you can prevent the ankle from rolling outward excessively. Next, try the single toe raise. Athletes who have had recurring ankle sprains may find this particularly useful. Bend the left knee up and maintain your balance. Slowly rise up on your right toes with good balance. You may hold your arms out ahead of you in order to help. You should feel the back of the calf working. Slowly repeat 30 times and switch to the other side. The purpose of this exercise is to strengthen the hamstrings muscles in the back of the thigh. Kneel on the ground with your hands at your side or folded across your chest. Have a teammate hold firmly at your ankles or your calves. With a straight back, lean forward, leading with your hips. Your knee, hip, and shoulder should be in a straight line as you lean forward toward the ground. Do not bend at the waist. You should feel the hamstrings, buttocks, and calves working. If you feel a cramp, stop the exercise, stretch, and then resume. Notice the second athlete. As she moves forward to the ground, she incorrectly bends at the hip in order to use her hip flexor muscles. This negates the exercise. You need to use your buttocks, hamstrings, and calves to do this exercise correctly. Your hips should not bend at all during this exercise. Now we move on to section 2 of the program, plyometrics. The first exercise is a side hop over a flat 2-inch cone or a chalk line on the field. Slightly bend your knees and jump to the opposite side with a soft landing. Remember, a soft landing is when you land on the balls of your feet with bent knee and hip. This is really important. Look at player number 1. She's doing the exercise perfectly. Her feet and knees stay hip distance apart, her landing is soft, on her toes with bent knees and hips. Also, her knees never translate over her toes. Player number 2 is demonstrating poor technique. He lands on a flat foot with a rigid landing, and his knees are caving in. This puts undue stress on the knee joint, namely the ACL. Repeat this exercise for 30 seconds with good form. The next exercise is pretty similar to the first. Instead of hopping side to side, we'll hop forward and backward over a flat 2-inch cone or a visible line on the field. Stand facing the cone with your feet and knees close together. Bend your knees and hips slightly and hop over the cone. This athlete is demonstrating poor technique. She lands flat-footed and circumducts her feet when she jumps backwards. As she begins her jump, her knees cave inward as she loads her jump. This is dangerous to the knee joint. Notice the first athlete. He has good control of his motion, landing softly with his feet and knees hip distance apart. Repeat the exercise for 30 seconds with a soft landing. The next exercise is an advanced version of the last exercise. Instead of jumping with 2 feet, we're moving to a single leg hop. Only progress to this exercise when you can complete the double leg hops without any difficulty. Hop over a flat 2-inch cone or line on the field, landing on the ball of your feet, bending at the hip and knee. Keep your ankle, knee, and hip in a straight line. Now hop backwards over the cone using the same landing technique. Notice the athletes show good control. Their ankles, knees, and hips are in a straight line. Their landings are soft. You want to be very careful not to snap your knee back into a straightened position. Do not hyperextend. Always keep a slight bend in the hip and knee and land softly. Repeat for 30 seconds. Now stand on the left leg and repeat the exercise again. The same progression exists for the side-to-side lateral hops. Start with a slight bend to the standing leg, bend the opposite leg approximately 90 degrees, hop to the opposite side of the cone or line and land on the same foot with a bent hip and knee and utilize a soft landing technique. Be sure that your knee does not cave inward as you land on that side. Use your outside hip and buttock muscles to stabilize your landing leg. Jump to the other side. Repeat for 30 seconds and then switch legs. For diagonal hops, use a series of cones or align yourself adjacent to existing lines on the field. Jump in a diagonal pattern using proper landing technique. Land softly on the ball of your foot, bend your hips and knees to engage your hamstrings, and do not allow your knees to cave inward or translate over your toe. Repeat for 60 seconds. Notice the second athlete. She lands with a flat foot and her knees drop inward as she prepares to jump and as she lands. She's not using her outer hip and buttock muscles to adequately stabilize her knee. If you are struggling with this, concentrate on keeping your knees over the 4th and 5th toes. Use your outer thigh and hip to keep the knee from falling inward. If you can adequately perform this exercise with proper technique, you can attempt to do it on one leg. This is an advanced exercise, so only progress to this level when you are certain that you can stabilize your knee. Now let's work on jumping vertically. This exercise will help increase the height of your vertical jump and increase the awareness of your ankle, hip, and knee in space. Stand with your arms by your side, bend your hips and knees slightly, and explode upward. Land softly on the ball of your foot with knees and hips bent deeply. Pause for a moment at the bottom of the jump to feel the deep knee and hip angle upon landing. Take off for your next jump. Be certain that your knees do not cave inward. Keep a good distance between your knees to ensure that you're using your outside hip muscles. Look at athlete number 2. Notice that her knees cave inward excessively. As we have discussed earlier, this is a dangerous position for the knee and the ACL specifically. Notice her knees translate over her toes. Her knee and hip angle is too shallow. She needs to sit back in her squat to effectively use the buttocks. When you use your hips and buttocks, you can shift your weight back, and your toes should be revealed to you. Take a look at our athlete. She keeps her hips and knees apart. Repeat for 30 seconds. Scissor jumps are a great exercise. They increase power, strength, and stability. Stand forward with your hands at your side. Jump forward, leading with your right leg. Keep your hip, knee, and ankle in a straight line. Make sure when you jump, your knee stays over your ankle at a 90-degree angle and does not drop inward. Now push off with your right foot and propel your left leg forward as you bring your right knee backwards. Land softly with a bent knee and hip. Look at your body's position. Make sure your technique is correct. This athlete exhibits incorrect form. Her back knee does not flex toward the ground and her lead knee caves inward excessively. This is incorrect technique. Repeat the exercise correctly for 30 seconds. Now let's move on to the agility portion of the workout. This portion of the workout combines speed, power, and skill. We're going to show 3 different agility exercises. The first agility exercise is a forward run with 3-step deceleration. This exercise promotes proper deceleration technique. Start in an athletic stance with a bent hip and knee. Lead with your right foot and push off with your left. As you approach the first cone, you want to decelerate over 3 quick steps before you change direction to run to the next one. Make sure your knee does not translate over your toe and you are using your buttocks and hamstrings to decelerate effectively. Stay low to the ground, bend your knees and hips. Use the 3-step deceleration to decrease the forces that are generated through your knee. Our second agility is a lateral diagonal run. During this exercise, you want to encourage proper technique through stabilization of the outside planted foot. Face sideways and side shuffle to the first cone. Pivot off the left leg, outside foot, and shuffle to the second cone. Now pivot off the right leg and continue on to the third cone. Make sure that the outside or the pivot leg does not cave in. Keep a deep bend in the hip and knee and make sure the knee stays over the ankle joint by using your buttock muscles. The bounding run increases hip strength and speed. Starting at the first cone, bound across the field with the knees coming up high. Take a long stride with the thigh parallel to the ground. Land softly on your toes with a bent knee. Watch our athletes. Their hips, knees, and ankles are all in a straight line. They land softly on their toes with bent knees. The last athlete has poor form. See how her lead knee caves inward as she takes off and lands from each skip? She's not using her outer hip muscles effectively. Her knees should not cave inward. Repeat for 1 minute. You may now begin your training session. Please finish each training session and game with a proper cool-down period. It allows the muscles that have been working hard throughout the training session to elongate and relax. It promotes healing of the tissue and reduces the onset of muscle soreness. Also, each athlete should have a water bottle by their side during the cool-down. Water replacement is crucial for optimal performance. Most athletes only replace about 2/3 of the water they sweat off during exercise. Therefore, you need to drink water even when you're not thirsty because thirst is not a reliable indicator of the athlete's fluid needs. The cool-down should take approximately 10 minutes. It should begin with a slow jog to allow the heart rate to come down before getting on the ground to stretch. Now let's start the stretching portion of the program. By properly stretching each muscle group, you can improve your available range of motion, decrease the chances of post-exercise soreness, reduce the risk of injury, and improve overall performance. So don't skip it. The first stretch is the calf stretch. You are stretching the large muscle of the calf, also known as the gastrocnemius muscle. Stand with your right forward and your left leg back. Bend forward at the waist and place your hands on the ground so that you are in a V formation. Keep your right knee slightly bent and hook it around your left leg. Keep your left leg straight and your left foot flat on the ground. Hold the stretch for 30 seconds without bouncing. Notice the athletes are performing the stretch correctly. Their back legs are straight, feet planted on the ground, their hips are level, and the head and neck are relaxed. Stretch for 1 minute. The next stretch is the quadricep stretch. Here you are looking to stretch the front muscle of the thigh. This exercise can be done with a teammate. Place your left hand on your partner's shoulder. Reach back with your right hand and grab the front of your right ankle. Make sure you are standing up straight and your knee is pointed down toward the ground. Keep your right leg close to your left. You should feel the stretch along the front of the thigh in the quadriceps muscle. Hold for 30 seconds and switch sides. Notice the male athlete is exhibiting poor form. Be sure not to lean to the side or allow your knee to drift outwardly. Keep your knee pointed down and trunk stable over your hips. The next stretch is a hamstring stretch. Sit on the ground with your right leg extended out in front of you. Bend your left knee and rest the bottom of your foot on your right inner thigh. With a straight back, try to bring your chest toward your knee. Try not to round your back. If you can, reach down toward your toes and pull them up to your head. Do not bounce. You should feel the stretch in the back of your right thigh. Hold for 30 seconds and repeat on the other leg. Next is the inner thigh stretch. Lunge to your right, stretching your left leg to the side. Feel a stretch along the adductor group of your leg, or inner thigh muscles. Keep your weight back to reveal your toes. Hold the stretch for 30 seconds and repeat to the opposite side. This is called the pigeon stretch. Bend your right knee at a 90-degree angle in front of you. Extend your left leg in back of you as straight as possible. You should feel a stretch in the deep hip rotators in the lead leg and the hip flexor and quad of the back leg. Hold for 30 seconds and switch sides. Now let's try the kneeling hip flexor stretch. Kneel on the ground and place your right knee out ahead of you. Lunge forward to stretch the back hip flexor. Be careful not to extend your knee over your lead toes. You may need to lift the lead foot and inch it out ahead of you to avoid translating over your toe excessively. If you do not feel a stretch in the back hip flexor, reach back and pull your foot toward your buttock. This will increase the stretch to the quad and hip flexor. Hold for 30 seconds on each side. Finally, all of the following muscle groups should always be stretched during a cool down: hamstrings, calves, inner thigh, quadriceps, and low back. This concludes the Santa Monica ACL Prevention Project. Thank you for your attention and be well.